of dollars. That's the economic impact of the 6 major hospital systems in Greater Cincinnati. The leaders of those hospitals took part in the first of its kind CEO summit recently held by the Courier. And what they discussed is the centerpiece this week. On the front page, the future of healthcare. The 6 of them touched on everything in front of a packed house at Memorial Hall, from the government's role in health care, attracting and retaining workers, to the quality of care. Courier reporter Barrett Brunsman is here with editor Rob Dahmeyer to talk more about the forum.
Thank you very much, Barrett. Thanks for being here. So this was really an amazing group that came together for this talk. What is the economic impact of these hospital systems? How many people do they employ, and what do they mean to the city?
Yeah, Rob, the reason this is a big deal is collectively these 6 hospital systems employ more than 65,000 people.
Wow.
Cincinnati Children's Hospital is the #1 employer in the region with more than 16,000. Tri-Health #4, followed by Mercy and Christ and St. Elizabeth. So it's not just the fact that they're paying all these people. There's the indirect spend because the employees are going out and buying things in the community such as cars or groceries, whatever. But Children's Hospital alone has a budget of more than $2 billion, and each of the other ones has a budget of nearly $1 billion to well above $1 billion. So the economic impact is enormous.
It's incredible. So they're always looking for people. They're always looking for talent. Children's, we know, is looking internationally. They probably all are, frankly. When you talk to these CEOs, what did they tell you about how easy or hard it is to attract talent to Cincinnati?
Yeah, Children's wants to attract the greatest talent in the world, and so they have employees from more than 75 countries. But UC Health as well, recruits talent on both coasts. One interesting point that the CEO of UC Health, Dr. Rick Lofgren, made was he thinks Cincinnati actually makes it easier to attract and retain talent. The young folks dig the Oakley Square and over the Rhine, and mid-career people come to Cincinnati and they say, wow, I can buy a house for this?
Right.
So those actually help. Those are positives that they saw.
So let's talk about something that's maybe could be negative. The Trump administration has talked about making some cuts to a wide range of government programs, including some in healthcare. What did the CEOs say about these possibilities?
Right. The day before we held this forum, the president's administration said they want to do significant cuts to the National Institutes of Health, the Centers for Disease Control, as well as Medicare, Medicaid, the Affordable Care Act, and even the Children's Health Insurance Program. Each of the CEOs noted this could have a significant impact on the people they serve. Some of these hospital systems, up to half of their patients participate in one of these federal or state-funded insurance programs. UC Health and Children's attract hundreds of millions of dollars in grants every year, and a lot of that comes from the National Institutes of Health. So they have tight margins as it is, and they sort of gave a shout out to let folks know, hey, you might want to talk to your local, your state, and your federal legislators to say, hey, please don't cut these budgets. They're too important for what we do.
Yeah, well, we'll be keeping our eye on that. But great job at the summit. It was just fantastic to be able to see this in action, and you can read all about it in this week's paper.